It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my 79-year-old sister has had seizures and she's now in intensive care. She's not waking up and she's having a tracheostomy. Can she improve? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another frequently asked question that we get from our readers, and the question this week is: how long can a critically ill patient stay on life support? So today's question is another one of those questions that we get quite frequently from our readers at IntensiveCareHotline.com. It's also one of those questions that families in intensive care tend to shy away from asking the intensive care team directly, because it can be too confronting. So first off, let's look at some of the definitions here, and I want to clarify what life support is in intensive care. So life support in intensive care usually involves the following: mechanical ventilation, heart or lung bypass, also known as ECMO, vasopressors and inotropes, also vasodilators, urinary catheterization, dialysis, cardiopulmonary resuscitation, defibrillation, artificial pacemaker, feeding tube, and total parenteral nutrition, also known as TPN, which is intravenous nutrition. Therefore, it's quite a wide range, and the most important ones are really mechanical ventilation with a breathing tube, also known as endotracheal tube, or with a tracheostomy, as well as mechanical ventilation with mask or BiPAP ventilation. Other very important life support mechanisms in intensive care are dialysis for acute or chronic kidney failure, ECMO for heart or lung failure, inotropes, also known as vasopressors for hypotension, which is low blood pressure, vasodilators for hypertension. Hypertension is high blood pressure. Defibrillation and cardiopulmonary resuscitation, also known as CPR, and artificial pacemaker. They are the most important and also most common mechanisms of life support in intensive care, and other mechanisms of life support such as TPN, which is intravenous nutrition, PEG or nasogastric feeding tube, or urinary catheter are almost always a subordinate form of life support compared to the most common and also most important forms of life support, such as mechanical ventilation, dialysis, ECMO, inotropes or vasopressors, and vasodilators. Therefore, the focus of life support in intensive care is really all about mechanical ventilation, dialysis, ECMO, inotropes, vasopressors, defibrillation, cardiopulmonary resuscitation, also known as CPR, and artificial pacemakers. That's what's most commonly being referred to as life support in intensive care or critical care. And because so many families in intensive care want to know about it, it's also a hot topic with many unknowns and many grey areas. So, why should I be the one telling you all about how long a critically ill patient should be on life support for? Well, after nearly 20 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager for more than 5 years, I have learned many things in intensive care that I know most families of critically ill patients in intensive care want to know about. And because I also constantly counsel and consult families in intensive care through my one-on-one, either face-to-face or phone, counselling and consulting service here at intensivecarehotline.com. Therefore, I work with and have been working with families of critically ill patients in intensive care for a very long time, and I know what questions they have. So if families in intensive care, for example, want to know about how long can a critically ill patient stay on life support, the answer to this question is particularly important if your critically ill loved one is either very unstable and in a very critical condition, or in a life-threatening situation, or is not waking up after an induced coma, or is in intensive care for long-term treatments and long-term stays, including long-term ventilation, or your loved one may be having a severe or traumatic head or brain injury, including stroke, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment might be, quote unquote, in the best interest for your critically ill loved one. Or your loved one may be approaching the end of life in intensive care. And because those are the situations where your critically ill loved one may be in a situation where they need life support for a long time to come. Therefore, the answer to our original question is crucial, and it can literally be a life or death answer. Now, first off, before we dive deeper, the answer is not what you think it is. You may expect me to come up with some time frames and length of time a critically ill patient can stay on life support. And again, that may be part of the answer, but more importantly, the answer to the question, how long can a critically ill patient stay on life support, is an answer that heavily depends on your and your family's mindset. If you and your family are like 99% of the families of critically ill patients in intensive care, and you believe everything the intensive care team is telling you, or even worse, if you feel intimidated by their perceived power and their perceived authority, you'll probably buy into the time frame thinking and the limited mindset thinking of the intensive care team. Therefore, the answer is not what you think it is. The answer is really dependent on what you want and what you feel is right for your critically ill loved one. If you feel like your critically ill loved one has a chance of recovery given more time on life support, then you should simply be asking for it in no uncertain terms. 99% of the families of critically ill patients in intensive care make no informed decisions, have no peace of mind, no control, no power, and no influence. Given that you are here, there's a very good chance that you are trying to get into the tiny 1% bracket of the very few families of critically ill patients in intensive care who do make informed decisions, get peace of mind, control, power, and influence. And given that you are here, you are most likely looking beyond the intensive care team's standard responses towards families, which are almost always a result of what's happening behind the scenes in intensive care. What's happening behind the scenes in intensive care tends to be so powerful that it almost always impacts on how the intensive care team answers the question of how long can a critically ill patient stay on life support. Therefore, the positioning of your critically ill loved one's diagnosis, their prognosis, as well as the care and the treatment offered or not offered by the intensive care team is indirectly giving you the answers about this crucial question from the intensive care team's perspective. Therefore, the intensive care team's answer to our original question, how long can a critically ill patient stay on life support, is heavily influenced by hospital and intensive care unit management, by the culture within the intensive care unit, and by their massive need to stay in control of the meaning of the situation. and that's certainly not your perspective. You and your family truly have the best interest of your critically ill loved one at heart. You and your family also want to stay in control of the meaning of the situation. The intensive care team, on the other hand, truly has the intensive care unit's best interest at heart, and that may or may not include your critically ill loved one's quote-unquote best interest. More often than not, intensive care teams position limiting life support or withdrawal of treatment as being quote-unquote in the best interest for your critically ill loved one. They are in essence saying that they're not prepared to prolong life on life support. Now, I can tell you that I have seen many critically ill patients being on life support for a very long time. So you may wonder, what's a long time? Definitely many weeks, definitely many months, and in some cases many years, if not decades. It really all comes down to your mindset and how prepared you are to stand up for what you want. Obviously, there are situations where no fancy equipment, no fancy surgery and no fancy drugs can save a life. It's just the reality. However, there are many cases where the right negotiation strategies, the right negotiation skills, the right insider knowledge, the right positioning of your critically ill loved one's diagnosis, their prognosis, as well as their care and their treatment, will give you every bargaining tool and every bargaining power you need to keep your critically ill loved one on life support for longer than the intensive care team would want them to. Intensive care teams often limit their thinking in what's possible around the availability of resources, including emotional resources. So, what do I mean by that? To prolong and preserve life, as well as giving your critically ill loved one the best shot at a meaningful recovery, also takes emotional resources, and many intensive care units are not prepared to invest the emotional as well as physical and financial resources. Intensive care units and intensive care teams often frame and position a potential recovery of your critically ill loved one as a recovery that wouldn't guarantee quote-unquote quality of life for your critically ill loved one in the future. I call BS on all of that. You can't measure quality of life, and in some instances quality of end of life. It's a term that, especially in intensive care, is being misused and used out of context. Quality of life is very subjective, and everybody's goal for quality of life is different. Very few people in intensive care know what quality of life ex-ICU patients live 6 months after being in intensive care. There are very few or no statistics. The bottom line is that people are alive and want to live. In light of the fact that people tend to stay on life support for longer and longer, and especially with services like intensive care at home being readily available, extending life support in a meaningful setting is also bringing quality of life to patients and their families. A service like intensive care at home offers a genuine alternative to a long-term stay for adults and children on life support, mainly needing mechanical ventilation with tracheostomies. Especially in this day and age, where families in intensive care are getting more and more educated and are getting more and more savvy to get what they want by challenging the intensive care team's perceived power and their perceived authority. Therefore, the answer to our original question, how long can a critically ill patient stay on life support, is an answer that lies within you. And it's an answer that is way more dependent on your mindset, on what you think is possible, rather than waiting for an expert intensive care team to tell you what's quote-unquote in the best interest for you, for your family, and for your critically ill loved one. Decide for yourself and you will reap the rewards. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counselling and consulting with me via Skype over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.